Hello, my name is Tegan.
And I'm Casey.
I'm Michelle.
And we are fourth year nursing students.
Today we would like to discuss medication errors as a graduate nurse.
We'll prevent these events from occurring in our transition to a professional practitioner.
To begin, it is important to note that 10% of the nursing workforce employed in acute care settings is made up of new graduate students.
That is a significant amount of the nursing population, all experiencing the same challenges as they transition to becoming a competent registered nurse.
When considering the challenges that a new graduate faces by adopting a new role within the healthcare team, it is important to be aware of a few key concepts.
Number 1, communication, the most important factor to relational development and growth. Being able to report findings, document in the medical record, delegate to assisted personnel, explain plans of care to patients, handle conflict, and receive feedback. I know on one particular occasion in clinical experience, I could have caused a med error due to lack of communication. When I went to go check the MAR for this patient's medication, I realized this PRN medication had been hand-wrote by the previous nurse. There was not a double cosign, which prompted me to check the doctor's orders. When I checked the doctor's orders, the dose and the time had been written incorrectly in the MAR. The nurse previously had to handwrite this medication because pharmacy had gone home after hours. However, because of the lack of double cosign, I was able to prevent this medication error. Essentially, communication is key.
Number 2, time management. Stats show that delay of care has been found to contribute to 37% of adverse events involving graduate nurses. A particular study by Wittenberg and Moriarty recommended new graduate nurses to divide tasks into 4 categories to carry out their day more efficiently. These categories included important and urgent, important but non-urgent, not important but urgent, and not important nor urgent. Based on these categories, graduates found that they could better prioritize their day, leading to improved patient care and effective time management. From clinical and undergraduate experiences, I have learned that time management is essential to prevent medication errors. When I transformed from a student nurse to an undergraduate nurse, I had twice the patient load and more responsibility. I learned that time management is essential to provide optimum patient care and prevent medication errors.
And lastly, number 3, lateral violence. In the midst of all the chaos, new graduates also tend to feel overwhelmed and professionally isolated. Registered nurses who display violence to new graduates or other nurses provoke anxiety and stress for novice nurses. Working within environments that are confrontational, aggressive, and intimidating have been found to lead to poor patient outcomes and discouragement of the nurse. Knowing where to seek support and how to stand against the harassment has prevented novice nurses from practicing outside their scope of practice when told to do so and providing unsafe care to patients that could result in an array of adverse outcomes. I once experienced this type of violence this summer as I began my undergraduate nurse position, I guess. I had a senior nurse approach me on the unit and essentially bullied me into withholding a patient's cardiac medication that I really believed they needed. It really questioned my knowledge as a nurse, because even though I felt that it was wrong, because of this nurse's experience, I was really intimidated by her and I made that error. Luckily, on my very first day of my undergraduate position, my unit manager had assigned me kind of like a nurse buddy, and it was basically another RN on the unit that I could go to and talk to about anything, and if I had any problems, they would help me to kind of solve those problems. So I actually went to her and we kind of talked the situation through, and thankfully she was so encouraging and really empowered me as an undergraduate nurse and made me feel that what I thought was right was the right decision and the senior nurse was in the wrong. So that's how I experienced lateral violence.
Anything to do with medication administration that can harm a patient, or not removing a nitro patch.
An example would be giving the wrong medication, such as Lantus versus Humalog. Giving a medication at the nurse's convenience, when Ativan was prescribed for anxiety in the morning, but was instead given at night to help the patient sleep.
Giving long-acting hydromorphone instead of short-acting, or mixing up medications like diphenhydramine and dimenhydrinate.
So Wolf defines medication errors as mistakes associated with drugs and IV solutions that are made during the prescription, transcription, dispensing, and administration phases of drug preparation and distribution.
The American Society of Hospital Pharmacists define 9 categories of medication errors as follows.
Number 1, omission error. Example, not giving a patient their nebulizer at bedtime because they were sleeping. Number 2, unauthorized drug error. A duplicate dose, a wrong patient, or an unordered medication. Wrong dose error. Giving 50 milligrams of fentanyl instead of giving 50 micrograms.
Number 4, wrong route error. For example, giving an IV medication instead of an oral medication, or giving it at the wrong site, like a right ear versus left. Number 5, wrong rate error. For example, infusing potassium greater than 10 millimoles per hour. Number 6, wrong dosage form error. For example, giving eye ointment instead of eye drops.
7, wrong time error. So this would be any time we administer statins. Everyone knows they need to be done at night, but giving it in the morning. Number 8, wrong preparation of a dose. So mixing that Pantaloc drip in a 50 ml mini bag instead of 100 mils. Incorrect administration technique. Everyone knows that the golden standard of administering an IM injection is a Z-track. So anytime you're not doing this, that would be an incorrect administration technique.
Medication errors are the most common breach of patient safety and the most predictable cause of adverse outcomes.
Unfortunately, performing a medication error has a lasting effect on the nurse and the patient.
So number 1, ask questions. Any nurse I've ever worked with has always told me, ask questions if I'm unsure. Nothing is scarier than a nurse who will not ask questions for fear of looking inadequate. In not asking questions, you're compromising your patient's safety, reducing the quality of care they deserve, and you're compromising your own professional growth. Remember, nursing entails lifelong learning. You'll never know everything.
Reporting errors and near misses. These reports are then reviewed by representatives of healthcare. Having these reports allows them to determine and implement strategies to help reduce that particular error. An example being medication vials that look the same but are different. Due to the reporting of errors involved with these medications, it has drove companies to repackage vials to be different.
Open communication. Maintaining communication and building relationships with colleagues will make it much easier to ask questions to help improve patient safety and quality of care. Make sure you're always using your 10 medication rates, your 2 patient identifiers, applying your allergy bands, knowing your drug interactions, and always triple checking before you give a med.
Some resources for graduate nurses are your fellow staff members. Hospital educators, unit managers, and other nurses upon the unit are helpful when you need to ask any questions. Alberta Health Services employees have access to Insight to look up parenteral monographs and any policies and procedures that are needed. Union representatives and CARNA are also good resources for graduate nurses.
Number 1, open communication. Communicate to other healthcare professionals if you feel uncomfortable about a doctor's order or recognize unsafe medication administration practice. Know your limits and when to communicate to others for help. Number 2, delegate. Is there a medication you are unauthorized to administer, such as a chemotherapeutic agent? Will you ask someone to help you? Also know your patient workload. Can another healthcare professional help to administer medications so that you are on track throughout your entire day? Number 3, ask questions. Ask about your medications you don't understand, potential side effects, drug interactions, and dosage levels. Seek out additional resources such as parenteral monographs and policies and procedures to guide your practice. Number 4, be assertive. Don't let other healthcare professionals bully you into performing improper medication administration techniques or unsafe nursing practice. Seek other staff such as unit managers or coworkers to stand against the harassment. Number 5, have confidence. We all know the saying, fake it till you make it. But how about knowing that through 4 years of nursing school, you actually have learned a ton of information and are capable of providing the best nursing care out of anyone? Trust yourself and keep learning. And lastly, number 6, know your 10 medication rights. Come on everyone, say them with me. Right patient, right dose, right time, right route, right medication, right documentation, right reason, right education, right assessment, right evaluation. Which leads us to our next form of entertainment. Enjoy, everyone. Hey, Michelle.
Hey, what?
How fast can you say your 10 medication rights?
Right client, right dose, right medication, right time and frequency, right documentation, right education, right... That's it.
Now that we have learned how to prevent a medication error, we look forward to the nursing practice that lies ahead and our successful transition in becoming a
A graduate nurse.